This video will explain how to provide immediate care to casualties following a blast event while keeping yourself safe. This is important information both for trained first responders and bystanders at the scene of a blast event. Even if you have no previous medical or first aid training, the information in this video can help you save lives and keep yourself and others safe in the immediate aftermath of a blast. The information in this video is based on the Paediatric Blast Injury Field Manual. This manual is available in both English and Arabic, and a link to it is available in the description accompanying this video. Before we discuss how to provide assistance to a casualty, it is important to think about how we can safely approach an injured person at the scene of a blast. In the immediate aftermath of a blast, the area may still be dangerous, and first responders can easily become casualties themselves as they try to provide aid. To avoid this, always follow the safe approach. Shout for help and call emergency services. Assess for danger and approach with care. Dangers may include further explosive devices, incoming missiles or gunfire, fire and building collapse. If there is a visible gas, an odd smell or multiple casualties without obvious physical injury, be concerned about a possible chemical attack. Retreat to safety and do not approach. Free from danger. Is the scene free from danger? If it is not safe, retreat to a safe distance and call for assistance. Evaluate. If the scene is free from danger, approach to evaluate the casualty and assist. Call walking wounded away from the scene. At all times, try to keep children with their parents or caregivers for reassurance and safeguarding. A blast scene is chaotic, and it may not be clear who is in control. In this situation, give tasks to helpful bystanders. You can ask them to call emergency services, control crowds, find transport if emergency services are not available. If the casualty is immobile, try to stay in their line of sight as you approach. Keep your hand raised and give loud, clear commands. Remember that some casualties may have hearing damage or be unable to follow your commands. Instruct any walking casualties to retreat to a safe distance. Always handle casualties with care to prevent further injuries. The key steps of immediate bystander care are shown in the first response triangle. The steps in order are: stop heavy bleeding, maintain airway, optimize breathing, maintain and early transport. The first step in first response is stop heavy bleeding. If there is heavy bleeding, check where it is coming from. Is it a limb injury, a limb amputation, or an injury on the body? If there is limb bleeding, apply an emergency care dressing or bandage tightly over the injury and around the limb. If you don't have a bandage, clean material can be used. If heavy bleeding continues, apply a second emergency care dressing or bandage. If heavy bleeding continues despite this, apply a tourniquet. The tourniquet should be applied above the bandage and tightened until the bleeding stops. A second tourniquet can be applied above the first if heavy bleeding continues. Detailed instructions on how to apply a tourniquet are given in Stop the Bleed Video 1, How to Apply a Tourniquet. A link to Video 1 is given in the description accompanying this video. In limb amputations, a tourniquet is the immediate choice for treatment and must be applied as soon as possible. The tourniquet should be placed just above the wound or amputation, making sure that you are over a bone. It should ideally be placed on bare skin. If you cannot cut or tear away clothing quickly, you can place the tourniquet over thin clothing, ideally no more than a single layer of clothing. The Stop the Bleed packs distributed by Save the Children contain emergency care dressings and a tourniquet, as well as scissors to cut away clothing and a pen to record the time of application of a tourniquet. If you do not have a tourniquet, you can use a piece of fabric, such as a scarf, the casualty's clothing, or your own, with a hard object, such as a stick, thick pen or metal rod, to achieve the same effect. The Stop the Bleed Video 1, How to Apply a Tourniquet, provides detailed instructions on how to apply an improvised tourniquet. If there is bleeding from the body, use Chitosan hemostatic gauze and gauze. Pack inside the wound with Chitosan and apply gauze on top. Do not remove any material from inside the wound. Use your hands to apply firm, constant, direct pressure over the wound. Maintain that pressure until medical aid arrives or you arrive at the treatment facility. The Stop the Bleed packs distributed by Save the Children contain Chitosan hemostatic gauze and gauze. If you do not have hemostatic gauze, cover the wound with gauze or clean material and apply direct pressure over that. If the bleeding is controlled, you can also instruct a helpful bystander to continue to apply pressure to the wound while you move on to the next step in care. Once the heavy bleeding is controlled, we then need to look at the airway. The airway is the passage by which air enters the body. It includes the nose and mouth, the back of the throat, and the windpipe, which passes through the neck and down to the lungs. We need to ensure that the airway is open so that air can get into the lungs. If the casualty is awake, crying, or talking, then their airway is open and you can move to the next step in care. If the casualty is unconscious or unresponsive or less responsive than normal, then we need to make sure that their airway is positioned correctly. This will ensure that their airway remains open and air can pass freely through it. As you can see here, this infant's neck is flexed forwards, causing the airway to become obstructed. Gently place the head in a neutral position with the nose pointing straight upwards. This should open the airway and allow air to pass through. You may find it useful to place a small roll of blanket under the infant's shoulders to help achieve the optimum position for opening the airway. Finally, have a look inside the mouth for any debris and remove anything that is clearly visible and can easily be picked out with your fingers. This is the correct way to open the airway in an infant under 1 year of age. Remember, if a person has suffered a blast injury, it is important to handle them gently at all times, supporting their head and neck when moving them. For anyone over 1 year of age who has been injured in a blast and has a reduced level of consciousness, place your hands on either side of the casualty's head as shown, keeping the head and neck straight and in alignment. The head should be in the neutral position, with the nose pointing straight upwards. The neck is neither flexed or extended. With your hands in this position, push upwards on the 2 corners of the jaw. This is called a jaw thrust. These 2 maneuvers, keeping the head in a neutral position and the jaw thrust, will help to keep the airway open in an injured child over 1 year of age or an adult. If the casualty is conscious, do not attempt to open their airway. Let them do that for themselves. The next step in care is to optimize breathing. Check whether the casualty is breathing. Is their chest moving? If they are breathing, place the child in the recovery position or allow the child to place themselves in a position of comfort. If they are not breathing, reposition their airway and check again. If they are still not breathing and you are trained to do so, support breathing. If you are not trained to support breathing and they are still not breathing after 2 attempts to open the airway, if there are multiple casualties, then move on to the next casualty. If there are no other casualties, then try again to reposition the airway and arrange early transport. Remove tight clothing and jewelry. So hopefully now we have stabilized the casualty by following the first 3 steps of the first response triangle. Stop heavy bleeding, maintain airway, optimize breathing. The next step is to maintain control of bleeding and airway and arrange early transport. Keep the casualty warm and dry, move to shelter if possible, and place clothing or blankets under and over them. Allow them to have sips of water, cover minor wounds if time allows. Do not delay transport, move to a medical facility as soon as possible. If no help is available, look for alternative transport. If possible, note down the location and details of the incident, casualty, and your actions to send with the child. Use a camera if available to record the scene. Ensure parents or guardians are kept with child casualties. If this is not possible, make sure they are aware of the destination of the child. Remember, always use the safe approach. Ask bystanders and walking wounded to retreat to a safe distance. Ask helpful bystanders to help you by calling for help and controlling crowds. Use the first response triangle to care for the severely injured. Stop heavy bleeding. Control the airway. Optimize breathing. Maintain bleeding control and airway. And arrange early transportation to the nearest treatment facility. Download the Stop the Bleed action card in English or Arabic. For more information, refer to the Paediatric Blast Injury Field Manual in English or Arabic.